Okay, want to welcome you all to this program entitled Managing COVID-Related Stress. And I think it's pretty timely that we're having this right now. I have with me my colleague, Elizabeth, who is my moral support and technical advisor. And then our speakers today, both are with Cheyenne Regional Medical Center. First of all, there's Brittany Wardle, and she is currently the Community Prevention Project Director. She's been doing this or in this field for about 10 years, and is currently the alcohol, tobacco, other drug, and suicide prevention contact. Would you say that? I'm not sure if that's the correct term, but that's her area where she's working at this time. She has a master's in public health and is also a certified community health education specialist. When she's not working so hard, she enjoys playing tennis, biking, or hiking, and spending time with her family and friends. We also have Angela Vaughn with us, and she also has a master's degree in public health. Her current area, she's working on opioid reduction and prescribing stewardship efforts. She too has the master's in public health, and she's currently working on a doctorate in global health sciences with an emphasis in healthcare delivery systems, which seems rather daunting, but good for you. Thank you for doing that. When she's not working hard, she is working hard. She teaches Olympic style boxing, and we were talking about that earlier. She also enjoys the outdoors and spending time with her family and friends. So at this point, I'm going to turn this over to the professionals who can help us all deal a little bit better with the strange stress responses we're feeling surrounding the pandemic.
Thank you for that kind introduction, Kim. We appreciate the opportunity to be here, and hopefully we'll share some interesting strategies with you that you haven't thought of before and try and reduce or manage the stress you're experiencing. So with that, I'm going to share my screen. And just as a disclaimer, I likely will not do the Mentimeter since there's a smaller group of us. But I'll show you what it looks like in case you've never heard of it. It's pretty fun. So this is just our title slide. We are within Cheyenne Regional Medical Center, the Institute of Population Health. So that means we work more at the community and population level rather than with individual patients. So what we're going to talk about today, the first thing is we're going to talk about the 8 dimensions of wellness, what those are. We're going to define stress and the additional impact we've seen with COVID-19 and this global pandemic. And then finally, after all the bad news, we're going to share with you the good news, how you can cope with it, how you can develop your resilience, and how you can ensure that you are coping the best way possible throughout all of this. So that's what you can expect to hear about today. So this is SAMHSA's definition of wellness, and I really like how well-rounded it is. And SAMHSA is the Substance Abuse and Mental Health Services Administration. It's at the federal government level. So this model really shows us the dimensions that define wellness in our lives. So the model really incorporates balance in all of these areas, while acknowledging at certain times, some of these areas may ebb and flow. Some may be worse for you now, better for you later. But we as human beings really value routines and habits. Definitely a way you can tell this is when you go to sit down, right, in a training classroom you've been in for a couple days and you try and steal someone else's seat that they've been in. People get really attached to their routines. This is where I'm sitting. This is my seat for the training. How dare you come sit here? So human beings really value that. And when we look at all these 8 dimensions, we're going to go into depth about what it means to be well in these areas. But before that, is where we had this Mentimeter where I was going to ask if you guys were feeling balanced. I'm going to ask Kim and Elizabeth, if you guys want to respond, I can open the Mentimeter.
I'm sure I will.
That way Jenny doesn't feel like we're maybe calling her out specifically.
I appreciate that.
Yes, absolutely. So this, so we all should be on a computer, right? We're on a Zoom.
Huh?
So I'm going to show this to you, and you should be able to see a code at the top where it tells you to go to www.menti.com.
Mm-hmm.
Type in this numerical code, that's 5774 5279, and you should be able to respond. Based on what you saw as those 8 dimensions, how balanced do you feel today, right now? You can agree that you feel balanced, you can disagree, you can go on either end of the spectrum, but today, how are you feeling?
Okay, I'm gonna have to open up another browser here so I can.
We'll give you a minute for it, because we have one more that we'll do before the end of the presentation.
Let's see. I lost my screen. There it is. So it's,
Do you need the code again, Kim?
yeah, well, I'm looking at it. I'm
Okay.
Mentimeter, menti.com. Okay. Sorry, I'm a little slow with this.
That's all right. Once you get it up, you'll be really ready for the next one.
Yeah, right. Okay. How come I ended up on Amazon when I typed that in? That's
Your computer's trying to tell you something.
this. 5774 5279. Right there.
Kim's trying to do this on a tablet, which I think is
Oh
harder
dear.
to-
Yeah, no,
between
that's
the-
probably a little bit harder.
527. Well, couple that with my technical challenges, then of course it's going to be like that. Let's see. Wow, this is this is crazy.
Do you want me to skip on and you can get the next
Yeah,
one?
you just go ahead. You just go ahead.
All right. So we have a disagree and an agree. I think what we found can happen is people feel balanced, and then we go through all the dimensions of wellness and they're like, oh, I don't know if I feel so balanced anymore. But by the end, after we talk about the coping strategies, we'll get you there. But I think it's important to kind of see where you're feeling now, and something to be mindful of every day. So we're going to talk about the dimensions of wellness and what they mean. So when we look at physical wellness, what that means is, are you recognizing the need for physical activity, for healthy foods? Are you getting enough sleep? So these things have all been very thrown off, especially during the pandemic, either in a good way or in a bad way, right? We've seen those memes about people suddenly making their own sourdough, which could be good, it could be bad, depending on how much you're making. But what habits have changed since we've been stuck in this pandemic? Another thing we've seen is perhaps an increase in substance use, whether that be alcohol, tobacco, or other drugs, but people are trying to cope by numbing some of those feelings with increased substances, or trying to maybe deal with some added responsibilities. And then, of course, we've seen some fear of going to the doctor for some of that preventive medicine, for your wellness visits, potentially further vaccines you might be needing. So something to be very mindful of, especially right now. Are you taking time to go visit the doctor even if you're feeling well? Are you taking time to get enough sleep for yourself? The other area on this slide is intellectual wellness. Something I think that has, again, with the restriction on things we might do otherwise, social activities, traveling. So are you taking time to stimulate your intellectual wellness? Are you recognizing creative abilities? Are you finding new ways to get new skills? Whether that be language skills, cooking skills, gardening skills, but things you might not necessarily have taken up before. Are you taking time to maybe grab some of those up while you're stuck at home? Making sure that you are pursuing personal interests, and especially as we think about aging, are you taking time to make sure you're exercising your brain when you might be retired and you're not necessarily exercising it for work activities? So being very mindful about that. Another one that we know no one likes to talk about, right? Money, financial wellness. So are you satisfied with your current and future financial situation? Are you keeping track of your debt and trying to pay attention to how much you're contributing to pay that off if you're able to? Or is that an area where you've had to take on debt due to job loss? Reductions in your wages because we've experienced a lot of turmoil in employment and businesses. So just being mindful of how you're saving, how you're budgeting, and making sure that that is not an area that's causing you significant stress, because we know, especially in what we've seen over the last year, that this might be an area where you've seen significant stress depending on your employment situation. And the other thing, I don't like to look at this, I'm a long way from retiring, but being mindful of how much you're putting back for that day when you eventually will retire. Is that something that you've prioritized? And if not, you might have an opportunity to look at that now. And this is, I think, a lot more stressful when we consider maybe a need for skilled nursing facilities or other debt that's piling up, but something to be aware of. The next one on this page here is environmental wellness. So we've heard a lot about this, I think, or thought a lot about it with our recent snowstorm and then 70-degree Easter. But are you taking time to make sure that you're getting outside, that you're getting time out in nature, you're getting fresh air when you're in your work environment? Kim was talking about this earlier, but is it neat and tidy if that's the way you like to work, or do you have a little bit of a mess? But being mindful that the environment that you place yourself in can really impact your wellness. We know that humans like to be in pleasant and stimulating environments. So try to curate that. Even if you're at work, can you have a nice plant on your desk, some pictures of your loved ones, but be mindful of cultivating the environment that you're putting yourself in. Then we go on to the next two. So spiritual wellness. This is really, do you find connection and purpose in your meaning of life, right? What does that mean for you? Do you participate in organized religion? Do you have other beliefs that you engage in? Are you spending time with others spiritually? So really making sure that you're not neglecting this portion, especially as what would be traditional spiritual outlets have not been as available over the last year. So have you been making time or trying to connect in a different way than previously you had before? The next one's also a big one we've seen impacted: social wellness, your connectedness to your community. Do you have a sense of belonging? This is really important for people. This is one of the areas that we've seen a significant impact in from COVID. And I think everyone feels that need. That Zoom is great and it offers an outlet to connect with people virtually, but I think it's also brought people some understanding that they really need and desire that in-person connection, whether that be your community, you have hobbies, if you're a master gardener, if you're in a running club, which I would never do, but is really enjoyed by some people. But those ways that you connect into the community in which you live in are very important. And we'll talk about this later, but that sense of connectedness and belonging in your community is really important for a protective factor for our mental health. So we'll touch on that a little later, but very important, making sure that you have a solid support system and connecting with those folks. And Jenny, feel free to throw a question in the chat or interrupt. We're happy to answer any questions.
Okay, thanks.
Yep. So the last two I'm going to talk about, occupational wellness and emotional wellness. So occupational wellness is really about where your work environment is, your work relationships with your colleagues. I think an important one that's come to light with the work from home experience is really that balance. Do you have balance from being away from work, stepping away from that? And how are you accommodating that balance when you think about bringing that work where it's always home with you? So something I think that's become increasingly important for people. And then accomplishment. Do you get personal satisfaction from your work? Do you find what you're doing enriching to your life? So making sure that, if possible, that you can derive some sense of personal satisfaction from your occupation. And then our last one here, which we're really here to talk about today, this dimension, is emotional wellness. So this is where our feelings and emotions lie. This is where we talk about, do we have satisfying relationships? Are we taking care of ourselves? Are we managing our stress effectively? Are we using it positively? Are we off kilter and now that stress is really impacting us and those around us negatively? So we'll be talking about this one further in depth as we move forward. So those are the 8 dimensions. And I think after you've had a chance to hear a little more about them, you could see where it's really hard to feel completely balanced in all 8 of them. There's a lot to these, but there's a lot that makes humans feel and physically be well. So it's important to know that these are really a comprehensive picture of wellness, and that with the ebb and flow, everything doesn't have to be perfect all the time, but really trying to achieve that balance in your dimensions. All right, so what is stress? What does that actually mean? Stress is a natural response to a perceived challenge or threat. And as we all know from our lives, right, those challenges or threats can be a myriad of things. So when you look at stress and how it impacts the body, we know that there is a physiological response. So it builds up hormones in your body. This is where you see the freeze, fight or flight. I think I only have the freeze. I don't have fight or flight. So I'm not a good example of what to do in a very stressful situation. But it's important to be mindful what your tendency is when you get really stressed. I play tennis, right? So when the ball's coming directly at my face, I get very stressed and I freeze, which is very counterintuitive, right? You should be protecting your face. But think about what your natural response is, what your tendency is, and how you might be able to change that if you are actually cognitively thinking about it, because it can be done, but your natural response is the one that will happen first. Sometimes stress can be good. We've all experienced that, right? You have an upcoming deadline, whether that be a work deadline or you need to accomplish something for a family member by a certain time, but this stress can propel us forward. It can motivate us to get things done. It can be a positive. So it can really clarify our thinking. I have to get this done. It's really important. This is, Angela and her homework. I have to get this done. This is positive stress. But many times, and especially many times over the last year, we've seen what is considered excessive or chronic stress, because we've had now a lot of questioning, a lot of bad headlines, a lot of things that are really driving our stress response, and those things haven't gone away. So when you see that, right, that's when you start to see that negative impact, whether that be on our physical health, our emotional health, or how we're behaving. So, I think even further on that, we see threatening or dangerous situations, right, where you might be experiencing violence, where you might be seeing a situation that's very traumatizing. So that even further, our body takes that even further, and we use this as an adaptation. So our body is responding to this, and it's really important to acknowledge when you have a short-term stressful situation and when you have one that's longer term, because while the stress might be a little bit lower than in a traumatic sort of event or a disaster, it's much more longer term, and you need to be mindful of when that's happening. Oh, well, I have another Mentimeter. You guys ready for this?
Yes.
All right, one more. Let's see here. Okay, my voting's closed. I get it. What now? All right. So now I want you guys to think, and this will become a word cloud. It's not attributable to any certain person. So we won't know that it's, Angela saying that her dog's a source of stress for her. But just type in some words. I think you either have 3 or 5 that you can type in. What are your sources of stress right now? What's giving you heartburn, or what's causing you some anxiety? And like I said, you're welcome to do a few words in here. It'll all just kind of keep populating into a cloud.
It only let me put in one word. So you'll see what my word is. Big word.
Well, sorry, I thought I had put in a few.
If you want me to, I can tell you some of the ones that I.
Yeah, let's give one more minute maybe for people to type in something if they haven't yet, and we'll kind of chat about it.
Well, maybe it'll let me go back in. Let me try that. Nope.
Darn it. Well, I did it right the last time, but not for you guys, I guess. So I'm going to stop the word cloud, since I guess everyone can only do it once, but it's really great when it works, because you get this whole picture of all the things that occur in people's lives that can cause stress, and a lot of times a lot of different connections between people. So we have unknown relationships and grief. These are all things that I think normally are stressful, and in terms of the last year are even more stressful. I would say one of the things that's been stressful for me was, especially early on, was the variance of working from home with kids at home. I'm not a teacher. There's many reasons for that. Not great at it. So there was a lot of stress for me around, am I doing enough for work? Am I doing enough for my kids? Are they still learning? A lot of stress around that. So I'd love to hear from you guys if you're willing to share what else you've found to be challenging and stressful during this time.
Go ahead, Kim.
Oh, okay. I've had kind of the out of balance thing going on, but things that I used to derive pleasure from, I'm having a hard time with that. It's like, okay, well, I'll go exercise, but I don't like it anymore. And I don't, I get there and I don't want to do it, but I do it anyway. And it used to be that even if I didn't want to do it and I did it, I felt good about doing it at the end. Well, now it's kind of like, well, that's over with. So it's like there's really nothing to propel me, and I'm just not getting much pleasure out of it anymore, even though I know I need to do it and I do it. It's just there.
Well, thank you for sharing that. Elizabeth, you were gonna say something, I think.
Well, I have a couple that are sort of related. So one of my biggest sources of stress is hearing and seeing people who are denying reality, what I see as reality, that yes, masks do reduce the transmission and it's not a plot. And this is particularly stressful for me because my mom died from COVID in October. And that's part of my grief. Also, we had to put our cat down on Monday, who I had for 17 years, longer than I've known my husband. So they're all kind of wrapped up with, like, there are things we could do, but we're not doing them. And then the flip side of that with the cat was I knew there was nothing I could do and I had to do something really hard. And so I guess it's control, it's frustration wrapped up with grief, and then just the feeling that how much longer are we going to be fighting these battles?
Thank you for sharing. I'm so sorry to hear the loss of your mom and your cat. That's really, really unfortunate.
Yeah, and they're all wrapped up together, so it gets even messier.
And I do think, especially in the last year when we've had sort of our traditional grieving processes interrupted, that has really made it hard for people to, I think, to move forward. Not that I think there's potentially closure in those things, but I think those are traditions that we have come to expect. And so I think the loss of those has been something that people feel very strongly.
Yep.
Jenny, was there anything you wanted to add? You don't have to share. We're here if you'd like to.
Well, and just, really, when this started, I'm such an introvert. I really didn't think I had too much stress about things, but I do. The stress I have is probably mostly worrying about the other people in my life, like elderly, my children, same as you guys, trying to manage their own kids and school and working from home. And trying to be helpful, yet, trying to not to be a victim of COVID. Of course, now we're kind of seeing light at the end of that tunnel, but it has been really stressful, just change, it's a huge change. So.
Well, thank you for sharing. I think it takes a lot sometimes to admit whether you're having a struggle or you're feeling stressed and to ask for that help. But I think a big step is really acknowledging what you find is your stress at that moment, because we know that can be over time, or that can change given circumstances we have going on. So thank you guys for your discussion in that. I'm sure you've seen this in yourself. What are those reactions when we are stressed? What does that look like in our body, so we can identify it when it's happening? So physical or emotional symptoms can happen. Some of the common things that you see are listed here. I think we heard some of this from you guys. There was a feeling of helplessness, of frustration. When is this going to end? When will these circumstances be different? Of course, disbelief and shock. I think I really connected with what Elizabeth said about some of people's reality and how that differs from what I see as mine, and how challenging that can be, especially when it disconnects relationships based on what's happening. And then, of course, like I mentioned, physical problems, right? This is that pain that doesn't have necessarily a cause in our body, but those headaches, the stomach or back pain. It's really that physical manifestation of those symptoms. And then the last one, of course, where we're using substances because we don't feel good about things or we're upset. So I'm going to hand it over to Angela at this point. So that's kind of stress as an overall picture, but then what does stress look like when we add the pandemic on top of it? And kind of how's that influenced the way we see the world and the way that stress impacts us? So I'm going to turn it over to Angela. All right, can everyone hear me okay?
Okay. All right, so if I could get the next slide, please. So when we consider COVID-19, there is a substantial impact that it's had on everyone's lives. Even if you haven't maybe had COVID, almost everybody knows someone with COVID. Even those COVID deniers know people who have had COVID before. So it can be really tough to navigate these types of relationships as they progress. And it also is really important to know that COVID has disrupted essentially every system in America. It has disrupted our educational system. Our kids were at home for a really long time, and now they're back, but sometimes in limited capacities. And there's no one strategy that's working across the board. It has certainly disrupted our work relationships, especially since a lot of us have transitioned out of the office and then back in the office and then sometimes back out of the office. So there's no real routine we've been able to find any comfortability in. It has really had a lot of distress on our healthcare system, our healthcare workers. It has really stretched the capacity of healthcare in the United States very thin. And so that is something that we're actually, even though we're coming out of, especially in our emergency department, people are just catching up with those emotions. So even though their days might be better and less busy, they're just having that realization that this really happened. So it's really long-term what types of impacts that this pandemic has had on the United States and the world as a whole. And it's just important to know that, you know, back last March when we were like, oh, 5 weeks we'll stay inside and things are going to be back to normal. It's really important to start thinking of a new normal now. Even though things are actually starting to get back to normal, we still have this illness and this disease looming in the background. So just knowing that if we can work on resilience and be a little realistic and not think in a week everything's going to be better, things will transition back to normally gradually. So here is some average reporting symptoms of anxiety and depressive disorder. And these are numbers from 2019 here on the left in the blue. And then fast forward to January 2021, we've seen a significant increase in anxiety and depressive disorder. And that's because of a multitude of different things that I'll talk about. But this is just a really good graphic to show that this unrest and this anxiety and maybe these depressive symptoms that we've been feeling are definitely not internal. There are a lot of people feeling these feelings. So it's important to reach out, and we'll talk a little bit more about that as well. So there's a lot of factors that roll into pandemic stress. That first is that fear or worry about your own health or the health of loved ones, your financial situation, or loss of support services. So there's essentially every aspect of life and relationship that we can feel these types of stress in. You know, you're worrying about your loved one who might be sick with COVID and you might not be able to care for them, and just how that care is going. We had a no visitor policy here at the hospital for a long time, and for good reason, but it's still really hard not to be able to be with your loved one, especially if they're in a hospital setting, which can get very lonely too. Now we're transitioning more out of that, but even though it is for the best, absolutely, for transmitting disease, it can still cause a lot of stress and worry and a lot of uneasiness. Changes in sleeping patterns people are finding, because we're at home all day. I know certainly I am. I cannot get in a good routine. You know, I'm usually going out and coming home, and I have these expectations of the day. And then at night, when everything hits, it can be really hard to sleep. So really focusing on getting healthy sleep, it's really good for a healthy lifestyle. And then difficulty sleeping once you might go to sleep, you're only sleeping for a couple hours. All of these thoughts are racing through your head. You're having these symptoms. It can be really challenging. Worsening of chronic health problems, that can be for a multitude of things, whether you have gotten some sort of illness or you're having that stress response that is exacerbating those symptoms. It can be really difficult, especially if you have those anxieties about going to the doctor because you don't want to get sick. So it becomes a vicious cycle. So just knowing really when to take care of yourself, and also connecting with your healthcare provider so they know that you're having this uneasiness about maybe going to the doctor. So if things are progressing and you're feeling worse, you're not feeling like you're stuck at home. And then worsening of mental health conditions. We'll talk about mental health in more detail because there is a lot of stigma surrounding mental health, and we really want to get away from that mindset. And then finally, increased use of tobacco, alcohol, and other substances. These can be coping strategies for a lot of people. And especially as this pandemic has heightened, people have been relying on that more and more. I know that a lot of liquor stores have seen sales through the roof during this time. And they were essential businesses. So they've seen a lot of sales go up, and we can see people using these types of substances to cope. We also are getting a lot of conflicting information and guidance. So right now in Wyoming, our mask mandate was lifted by the state, but we still have businesses requiring masks. This can be really conflicting for a lot of people, especially when you want to do what's right, you want to support businesses, but when there's not these blanket type of guidances and you're getting a lot of conflicting information, that can cause even more of a stress response because you're really not sure of what to do. there's an abundance of information about COVID in general, and every day it's evolving because it is at the height of the priority list. You know, scientists want to figure this out, everybody wants answers, and the research is rolling. So you might find something that's outdated from just last week. So it's really good to make sure that you're keeping up with those credible sources, because there really is a lot of conflicting information. I know Elizabeth touched on this, but that people have, and these perceptions that people have, and then they throw them out on the internet. And so you can be getting a lot of different information from a lot of different sources. And when you are really uneasy and you're going down this rabbit hole of clicking and trying to figure it out, it can be really tough and can cause more stress for you. There's also tension in the community surrounding different guidelines. It's not something that I've necessarily seen personally here, although I'm sure that other people have, but you can hop on social media and see people fighting about masks all day long. So a lot of people don't want to be in those situations. And so as a result, they're isolating themselves more. So it's just really important to keep yourself educated about what the requirements are, even though the mandates might be conflicting, doing what is best for you and following store guidances. And then potential fear surrounding mask mandates being lifted is a huge thing as well. The state mandate was lifted, I think in Colorado, it's easing up a little bit, but a lot of people feel safe and comfortable in a mask. And so if that's something that you are still wanting to wear, by all means, you should. I know that there's a lot of opinions about masks, but at the end of the day, they've been shown to reduce transmission of COVID. And if you're wearing a mask, you're not hurting anyone. So you should absolutely do that if that's what's comfortable for you. Then we have on the other side of the spectrum, a vaccine. And even though it's really exciting, there's also new and different information about a vaccine, every single vaccine that's coming out. We started with 1, I think we're at 4 now. And so a lot of people are really excited about the vaccine. A lot of people are really nervous about the vaccine. There's a lot of different opinions about getting a vaccine, but it is really important to note that the research is evolving and there is a lot of credible information and they're updating it as soon as they can. I think right now, Wyoming you're able to get a vaccine 16 plus, which is really great. So they are available community wide. And I think that that's actually becoming more so of the case throughout the United States. But when they were only vaccinating those certain priority groups, there was stress around that as well, because you may want one, but you might not have access to one. So now there's a little less tension around that specific topic, just because there is a lot of resource that is being pumped out into the community and people can get vaccines as they need. A lot of people are stressed out about, oh, what could happen after this first dose? Well, I feel fine now, but oh gosh, what's going to happen after the second one? So just knowing your body and trying not to take those side effects and really run with them, having a good open lines of communication with your provider is always a good idea, because if you are worried about some side effects that you're experiencing, you don't want to hold that in. And then it's just important to weigh the risks and the benefits. You know, some people are choosing not to be vaccinated, others are choosing to be vaccinated, but just knowing exactly what is best for you, and knowing that if you're stressed more about it, that can inhibit even more of an immune response. So knowing exactly who you're going to talk to if these are the types of things that might stress you out, and just having that open line of communication with someone that you trust. That way you're not internalizing all of this stress should you have some sort of side effect that might cause any stress for you. And there is also an abundance of unsettling content. I'm just listing these things off, right? Like we think it's going to be one thing and then it's another and then it's another. I don't think that necessarily the media or social media in general has been really good about highlighting anything positive. And if so, the negative highly outweighs the positive. So there's always an abundance of information and upsetting content surrounding COVID, and it's on every single platform. You can't really get away with it. It's a worldwide issue. And there's also in tandem with this, there has been, no matter what side of the fence you're on, some political unrest. And so it's just stacking on top of this content on content on content. It can be very overwhelming. So maybe a lot of people can schedule time on social media and have found that helpful, because it can be really hard to take your eyes off, but it's also really important to get away from some of that content for a while, because it can really affect your wellness. Even though you want to be informed, being on that type of platform and seeing that kind of thing for 24 hours a day can really heighten the uneasiness that we might feel. And when we're seeing this type of content, it's triggering stress. So like I said, it's just really important to carve out those breaks. It's really hard because sometimes I'll get on Instagram, I'll get out of Instagram, and then I'm right back on it. I mean, it's just like, why did I even close it out? So I need to take some breaks. You can set those restrictions on your phone if you're worried about just mindlessly clicking, but it's also really important to note that taking the time away from the media and maybe just watching a movie that you like is totally okay. There's content coming out all the time, so it's unlikely that you would miss anything really big. And another thing that we've talked about already, pandemic grief and loss. It's a normal response to feel this type of grief, but then when we're adding on all of these other elements that we might be feeling, or these restrictions that might be happening, it can heighten that grief response. I know that we have lost so many people from COVID, and it's so hard for the families because you can't mourn in the way that you want to. And that's really tough and hard. And you don't get that closure that you might need or want, or that sense of belonging with the group of people that you want to mourn with, because you have to be apart. And that's really tough. Even if your loved one was lost and it wasn't because of COVID, there's still a lot of moving pieces that you have to navigate to make sure that you can have that type of closure. And then grief is something that we also, other things that we might not think of, you know, grief of your previous lifestyle where you wanted to go out in those social situations and you might not just be feeling like yourself. So you can feel a lot of those different emotions, and it's not for any one specific situation in particular, but just knowing that you have to recognize those emotions in order to, and it's really hard for a lot of people because we aren't given those settings like we were used to. These can be changes in lifestyle. A lot of people lost their job during this, and, you know, loved ones as well. So trying to find something that can help you get that sense of belonging, and grief can feel very lonely, unfortunately, but especially now when people have to be apart more than they would like to be, it can exacerbate those kinds of feelings. So try to connect with people on a different level. It can be tough. You know, I've heard a lot about like Zoom memorials, and it's hard because as much as we would like to, we might not feel those same emotions, and we might not feel as connected over a computer as we might in person. So it's really tough, but knowing that it is gradually getting better, and hopefully people are navigating those feelings of grief in a way that is making them feel like they have some sort of support system. Does anybody have questions or want to add anything before I get into some coping strategies? All right. You're going to? Okay. We will provide the PowerPoint, but there's a small video that you're more than welcome to watch as well. So when we talk about coping, there's a couple different things that we can do. Emotion focused coping is more so surrounded about that internal emotions, about the problem or the situation. You know, we can think as much as we want that we have control over COVID, but I certainly don't have control over COVID. Brittany certainly doesn't have control over COVID. It takes a very multidisciplinary approach to control, or even try to control something like this. So in those situations where you might not have control over the outcome, I mean, you're doing everything you can, but as much as I would love to solve this problem tomorrow, I'm not going to. Then we have to think about what types of emotional strategies can we use to help us cope with the situation since it is ongoing. We don't have control of it. It's not going to stop tomorrow. I mean, in the foreseeable future. It is gradually getting better, but what emotional things can we do? So this can be venting to a friend. I love that one. I love to call my friends and just vent and vent and vent. Positive reinterpretation of events. This can be hard with these kinds of situations, especially in a pandemic, where people are experiencing so much loss, but maybe trying to find some positive light. If you don't have that, then focusing on a different coping strategy. And then seeking out social support, whether that be family, a group of friends that you feel safe with. Social media, as much as it can be upsetting, can be really great for that too. And then we have problem-focused coping. So these are the types of strategies where maybe you do have a little bit of control of the problem. I wouldn't say COVID because, like I said, no one of us has control over COVID. But this is generating different options to solve the problem. So these are those types of instances where you might have some control over the situation and you can do something evaluating the pros and cons about this problem and what it impacts it's having on your life and what different directions that you can take to maybe solve some of it, and then implementing those steps to help solve the problem. Sometimes this can elicit a stress response too, especially if it's a problem that's been ongoing and it's been really hard to challenge head on. By taking steps to actually solve it, you can definitely experience those little bouts of stress at the beginning, but problem-focused coping is for those things that we have a little bit more control over. And then a couple other coping strategies is just taking care of yourself, eating healthy, well-balanced meals. It's really interesting because especially now, sometimes getting out and going food, I know a lot of people just are like, I gotta go get out of the house. So I'm gonna go just grab a quick dinner. And then 5 days in a row, they're just grabbing a quick dinner. So making sure that if you are doing that, you're trying to balance those out and not just make it so fast food centric. It can be really hard. Trying to find some exercise that you like. I box because I like it. I don't run, just like Brittany doesn't run, because running is not fun for me. So if you don't like running, don't run. Just finding things that you like to do actively to make your body feel good and finding those different outlets. Getting plenty of sleep, that can be difficult, especially if your body is in a stressful situation. You can go to sleep and wake up, but trying to really get in that zone when you're about to go to sleep and get a really restful sleep. And then giving yourself a break if you're stressed out. We're really stretching ourselves thin. Even when we're working from home, we can be like, oh, I've been home all day. Why am I feeling like this? It's okay to take a time out and go on a walk and give yourself a little bit of a break. And then talking to others, anybody that you might trust, sharing your feelings with, and then avoiding substances like drugs and alcohol. These might seem to help initially, but they can really help. They can also exacerbate those feelings as well. And reducing mental health stigma is something that I wanted to talk about a little bit as well. A lot of times when we hear about mental health, we hear about it in a negative connotation, but it is something that a lot of people do struggle with. So talking openly about mental health, educating yourself and others, being conscious about your language, which can be tough sometimes. We hear a lot of people say, well, that person's crazy. That can be very stigmatizing language. So trying not to frame people in that sort of light. Encouraging equality between physical and mental illness, which can be difficult too. Our healthcare system is highly focused on physical illness. And showing compassion for those who struggle with mental illness, choosing empowerment over shame, and being honest about treatment and not harboring self-stigma and keeping it all to yourself.
All right. Okay. So since we're touching on mental health, just a quick couple things about suicide prevention, right? We know in Wyoming that suicide is a serious public health problem. And there is hope for people who feel like they want to kill themselves, who are feeling hopeless, who are feeling like a burden. So just some warning signs if you have friends or family members that you're concerned about. One of the things you want to look for is talking about being a burden to others, feeling like they can't do anything to help their situation and that they're really dragging their friends or family down by needing so much help. Again, we've talked a lot about this, increased use of substances, right? That's definitely something you want to be mindful of. That feeling of isolation, which we've seen definitely more in the COVID-19 pandemic, are people feeling like they aren't connected, that they aren't feeling that sense of belonging with their group of friends. Any changes in their sleep patterns? Are they sleeping too much? Are they sleeping too little? Same with their moods and their emotions. Are they a lot more angry or upset than they usually are? Is there a lot of anxiety? Is there a lot of depression? These are things that cue you into this person might need some more help. And as always, when we talk about suicide, we want to talk about resources for preventing suicide. So if you or someone you know is in crisis, these are resources that can help anyone, anytime, 24 hours a day. So you can call the National Suicide Prevention Hotline, you can text, you can chat online. Feel free to share these resources with anyone you know that need them. There are a lot of resources out there. Suicide is preventable. There's a lot of hope that we can give people if we know that they're at risk. So please be very mindful of people that you see struggling and offer these resources as assistance to them. And then we're going to end on a positive note. We're going to talk about resilience after those coping strategies. So resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. So all the bad things, how do you react to them? How do you overcome those challenges? So there's a great TED Talk that's linked at the bottom of the slide. We don't have time, obviously, to watch it, but I'm just going to share with you the 3 key points from that TED Talk. So these are what the speaker referred to as 3 secrets of resilient people. So the first thing is that they know that suffering is part of life. And while that sounds like, you know, maybe a depressing fact, this is reality, right? We know that suffering is part of every human existence. And knowing this helps you feel like you aren't being discriminated against when you encounter some of those challenges. The woman in this video giving this talk was talking about how she experienced the loss of a child and how this framework really helped her identify what could help her be more resilient in dealing with that loss. So the second thing is to really carefully choose where you're directing your attention. Be mindful about where that is. So realistically appraising those situations, this is that saying about focusing on the things you can change and acknowledging those things, accepting those things that you cannot. So knowing where your effort is and making sure it's on things that you know you can change. Because as we've discussed, that feeling of helplessness and that you don't have control can be really detrimental. So choose where you're spending your energy, your time, and your attention. And then the last thing, ask yourself, is what I'm doing helping me or harming me? Her specific example in this was she found herself up late at night one time, flipping through a photo album of her daughter and feeling really upset, depressed, and sad about that. And she asked herself at that moment, am I helping myself or am I harming myself? And so it's something that sometimes it is really hard to take a step back and say, is this good for me or is this not? But be mindful about, is the way that you're thinking or acting helping you to get what you want, helping you to heal, helping you to be in a good place, to be able to revisit some of those memories. So whatever it is that you're struggling with, whether it's loss or grief or financial stress, just making sure that you're taking a step back for a minute to say, which road am I on, the helpful one, or am I on the harmful road right now? So those are really the 3 things she identified as helping cultivate resilience in people. So resilience isn't something you have or you don't, it's something that can be cultivated. So as you're facing problems and continue to, because we know we will, just check in with yourself in these 3 areas. Where am I directing my attention? Am I acknowledging that this isn't a bad thing that's only happening to me? Why me? But this is something everyone experiences. And then identifying what path you're on. So with that, we just put some resources on here for you guys. Many of these are resources for both healthcare and behavioral health, the National Suicide Prevention Lifeline again, the Quit Tobacco program, if you're so inclined to share this with either you yourself if you're using tobacco or with others who might be ready to quit. And then Wyoming 211, which houses a directory of many of the resources that we have available across the state. So with that, we'd be happy to take any questions. And thank you again for allowing us to talk to you about COVID and stress and coping and resiliency.
Thank you both, Brittany and Angela. I do have some questions. I had a lot of questions, but you've answered probably 99% of them. So that's probably good. I've read a lot and your comments about, and I've read this before too. Sometimes it's very difficult to do. The, what you pay attention to, the social media, the negativity, all the, was the politics and COVID, now it's COVID and maybe politics still and politics surrounding COVID. I have, I have taken myself off of social media completely. I did that way before COVID though. So, but I have found that's so much better mentally for me. But when it comes to dealing with some of the news that you get when you talk about, the new variants and things like that, with, I appreciate that people can have whatever opinions they have. And sometimes unsolicited information or opinions get a little, it's kind of hard to take sometimes. So that's one of those things where we all have to bite our tongues sometimes. That's just a natural thing. It's a human response. But one of the things that I think about when everything kind of, you start thinking about the fake news, the real news, the whatever, and I look back and I think, boy, it's almost like this is 365 days of my life I can't get back. And I'm not going to get younger about it, but then you do have to put it into perspective. But I read a lot about the new variants and all the what's going on, whether the current vaccine is going to help it or not. And sometimes I look at that and I think, you know what, that's the stuff you can't control, It doesn't matter. It's like Angela said earlier, and maybe Brittany, you said it, it doesn't matter where you go or what year it is, or, 20 years from now, I probably would still be wearing a mask when I had a cold because I wouldn't want to give it to anybody. I would appreciate if other people would continue wearing masks if they're not feeling well. These are things that are going to happen. So I guess there's really no question in it, but it is something that as you speak about these issues and the problem and the solutions or the tips that we can take home, it makes me less stressful. Just knowing that, okay, I have thought about that, but it's really helpful to know that, gosh, maybe I'm smarter than I think I am, because it's already out there, and that's a good thing.
Absolutely. I think we definitely have all employed some of these strategies, and it's helpful to bring some new ones into the mix, because I think regardless of how this moves forward, these are good strategies for whatever problems we're faced with. So definitely appreciate that reflection, Kim. Any other questions from you guys?
Well, not a question, but I appreciate the resiliency piece of this, because I think it's, it's hard to find positives out of this last year, but, just like people in the Depression and people of World War II and, who had lived through similar stressful situations, it's important to keep in mind how we can make ourselves more resiliency in spite of all the stress. So that's something I really think is important to keep in mind, and definitely will share with at least my kids and people I know that are kind of suffering from stress.
Good. I'm glad to hear that was useful. Well, we definitely appreciate the time that was given to us by the library and their support to be able to offer this presentation. And thank you, Jenny, for coming. We're happy to chat with you guys. And just remember the power of positive thinking. But if you need to feel sad and feel the feelings you're feeling, that's also very appropriate.
Thank you.
Thank you both very much. I know that there will be plenty of other people who will watch this later, and will gain a lot of information. So we appreciate your willingness and the time that you've given up to help us out here.
All right. Well, thank you guys.
Thank you.
Thanks.